RC701 received.
In Melbourne, paramedics Nat and Leonard are responding to a Code 1 emergency.
So we actually need to turn around.
Turn around?
So best is to get onto the tram lines. Nicely done. Okay, so what we know is we're going to an 81-year-old female. All it says is she's on the bed, she's not answering, and she was complaining of a headache. You're clear left.
Unconscious patient, elderly female, headache. The first thing that comes to mind is a stroke. Every second has huge implications on their quality of life and may even be the difference between life and death.
So if this is a genuine stroke, we can think about calling the stroke truck.
Yeah, absolutely. And they have a CT scanner on board.
They do.
And might only save a few minutes, but every minute
Clear left.
that brain doesn't have oxygen or blood makes a huge difference.
But suddenly, the emergency shifts up a gear. The call is now a priority 0. Someone's life is hanging in the balance.
Give me a bit of room.
No, you're good on my side.
Stopping
Yep, all
in the
good.
middle of the road won't do anything.
Okay, so you're going round the bends?
This must be it.
Yes.
Go into there.
Everything about this response is time critical. Despite the traffic, Nat and Leonard arrive within minutes.
Let's stop here.
Priority 0 cases are the most critical cases that we attend to. These people are generally not breathing.
Robert's a 0. You're in arrest, so let's go.
Straight away, I think we have to take all the equipment into this case. My gut feel is that she's got a catastrophic bleed, and it's clear to me straight away that this is a life or death situation.
What's her name?
Jenny.
Jenny.
Nat and Leonard have been called to an emergency at an inner-city apartment.
I've got a pulse, so it's not an arrest.
Okay.
It appears 81-year-old Jenny has suffered a massive stroke. Jim, her husband of 57 years, called for an ambulance when he couldn't wake her.
She had fixed and dilated pupils. Her pulse was slow. These are all clinical signs of a catastrophic bleed.
Still got a pulse. She's got a good pulse.
Okay.
So,
But she's not breathing. Respiratory arrest, really.
yeah.
So we realise that Jenny's not breathing properly, so most important thing is to ventilate. Could you just quickly tell us what's happened, sir? I realise there's a lot going on. Okay.
5 minutes to 8 minutes ago, came in to me and said, Jim, I've got a terrible headache.
In a desperate attempt to keep Jenny alive, Jim performed CPR until help arrived.
Has Jenny ever had a stroke before?
No.
We've got non-reactive pupils at the moment, just
Okay.
letting you know.
It quickly becomes clear that Jenny is very unwell. She has a GCS of 3, which means she is deeply unconscious, non-responsive. She appears to only have a rest rate of potentially 4.
And they seem quite agonal in nature as well.
Jenny has agonal rests. That's what we call dying breaths. I now realise we have a massive battle ahead of us. Hi guys, how you going? Hi.
A MICA team and the stroke unit have now arrived to assist.
It appears to be some sort of cerebral event.
agree with you.
Okay.
The specially trained stroke unit can provide a quicker diagnosis, allowing treatment to start faster, hopefully reducing any potential brain damage.
So at the moment, Jenny appears to be GCS 3. It appears that she has agonal rests. Initially, we had a rest rate of about 4.
Yep.
She's actually breathing up a little bit more.
So she's possibly having a neurological event.
Okay. That heart rhythm's changing completely. I can feel it. Yeah. We notice that Jenny's heart is actually starting to slow down. We're losing. Her life is in the balance here.
Jenny's husband, Jim, stands by watching in disbelief. For he and Jenny, the day started just like any other.
It had been a perfect day in the home. We'd both done the shopping.
Our heart rate's going down. Yeah. We need to get it onto the evac map.
I drove her around to the hairdresser's just around the corner, did another job myself. She arrived home looking glam.
So what we're going to do, we're going to move this bag to that side. We're going to roll her. Okay.
And she walked in and said, Jim, I've got a splitting headache. So I lay her on the bed and I quickly got her 2 paracetamol. It was almost instantaneous. When I said, "It's Jim here, Jen. Jim. Say Jim." And she never heard the question.
Let's go, Rob. We've done everything we can on scene. It's time to load and go. Jenny needs to be in hospital receiving definitive care to have any chance at surviving.
81-year-old Jenny is clinging to life after a massive stroke. Nat and Leonard are now working with specialist paramedics to get her to hospital as fast as they can.
I think in this job you learn very quickly to never give up hope. Things can change in an instant. They can go from good to bad and from bad to good.
Yeah.
You right, sir?
Yep.
Yeah.
Just a bit shaken.
Of course. It's a very stressful situation.
Jenny's husband, Jim, is travelling in the ambulance to the hospital.
Jim looks calm throughout the entire scene. Deep down inside, you just know that he's an absolute mess. You know, the love of his life is critically unwell. And I just felt so bad for him. I wanted to hold his hand when I was driving. I wanted to tell him that, you know, hopefully things are going to be okay.
The Alfred Hospital is only a few minutes away. As they race to the emergency department, Nat and Micah paramedic Tem are constantly monitoring Jenny's condition.
Oh, she's blinking.
Jennifer.
Hi, Jenny.
Jenny. Squeeze my hand. Squeeze this one. Okay, that's a girl.
Thankfully, we're just 500 metres from the Alfred Hospital. Our only goal is to get Jenny to hospital alive.
Did Jenny respond when you asked her to press her hand?
She's making a few little movements there, Jim.
Okay, we're at the Alfred, Jenny. We're going to wheel you in. Okay, sweetie?
Both Jenny and I have a fairly strong religious belief.
Yeah.
Faith went through my mind. Faith and hope.
There's going to be lots of people around you, okay? All taking care of you, love. As we wheel Jenny into the hospital, we're met by a team of doctors, and we know that she's in the best place possible. And in that moment, I am just hoping for a miracle here, for Jenny and Jim's sake. Straight into resus.
At Melbourne's Alfred Hospital, 82-year-old Jim kept a vigil by his wife Jenny's bedside after she suffered a massive stroke.
In Jenny's case, that was an external bleed around the brain. With the neurosurgeon and the support staff and my family. And they really recommended that the life support system was not going to work. And was probably to Jenny's benefit that it be switched off or the ventilator be ceased. Initially, it was disbelief. When you awaken in the morning or in the night and she's not beside your bed, it doesn't hit you initially. Jenny was certainly the love of my life. I don't know what life will be without her. I loved her companionship, her understanding, how we both complemented each other. It was a beautiful relationship.
Finding out Jenny passed away was heartbreaking. The first thought that came into my mind was devastation for Jim. No matter how experienced you get, no matter how good you get at being a paramedic, at the end of the day, you're still dealing with people. You're still dealing with loved ones.
What gives me peace is knowing that when Jenny passed away, her Jim was right by her side. She was surrounded by her loved ones, and she knew she was loved. It makes me appreciate what I have. It makes me go home and be grateful and thankful for my family, as I know that someone else's life has changed forever.